Premature newborns often require special care from nurses in a Neonatal Intensive Care Unit, or NICU, as their tiny bodies develop. Nurses want babies to sleep on their back before they go home. But while they are in the NICU, Associate Professor Karen Klingman from Upstate Medical University's College of Nursing says newborns often need to be repositioned to aid their growth.
If they're on their tummy, they push up, they can develop their shoulders and so forth. And then if they're on their back, that doesn't happen. So there's this trade-off that the nurses in the NICUs need to think about is, should the baby be on their back or should they be on their tummy to help with the development.
Upstate Medical University had interest in doing research on how sleep positions could affect development of babies in the NICU. But right now, the only data is from nursing logs entered manually each day. To develop an improved data collection method, Upstate Medical University professors teamed up with Bioengineering seniors in Syracuse University's College of Engineering and Computer Science to design a sensor that monitors infant sleep positions.
To give nurses and doctors the opportunity to have physical data of how long the infants are sleeping in certain positions and for how long, and they can use this to correlate, the health and development of the infant could be related to these side effects of them sleeping and in what position.
SU seniors Alyssa Anderson, Tierney Clark, Al Lee, and Sarah Venn designed and constructed a prototype using sensors underneath fabric connected to a custom-coded microcontroller board for their capstone design project. Lee was born prematurely, and she hopes their design will lead to more accurate data on some of the most fragile patients in any hospital.
The data collected by the computer, which is continuous and complete, so that will make the nurses work much more efficient.
The device can measure pressure from an infant's shoulders, behind, head, stomach, and knees. And with input from experienced nurses and engineers, the interdisciplinary project showed strong results during testing.
We couldn't have done it without them, and I don't know they could have done it without us because they wouldn't have the expertise to know exactly what to look for.
When you think about the effects of gravity on top of them, you really want to be sure you're putting your baby in the best situation, and they have no control really when they're sleeping. You're the one laying them down. Really trying to emphasize the importance of which position to lay your child. It's highly critical for their health.